you are going to die tomorrow. Can you believe? If you believe, you have some problem. Myself Sukumiii, I am the student of Occupational Therapy. Delusional disorder. What is delusion? Is a false belief. One person is believe something that is not accepted by the society or other person or any culture. Then that is a delusion. Bizarre delusion and non-bizarre delusion. Bizarre means abnormal. So bizarre delusions are not believable. So they said some impossible things are not understandable by any others. It is totally deviated from the ordinary life. Non-bizarre delusions are something related in the life, but it's not happening in that time. But there is a possibility to happen this non-bizarre delusion in their life. People with these disorder are not having any significant impairment in their social life, occupational life, and daily activities. They have no specific impairment, but they have this issue as a sideways. Same like their outward behavior, like what are all they doing is a outward behavior, are all same. They are ordinary. They are not looking like a bizarre behavior. They are very good in their behavior. What is the cause of the delusional disorder? So some theories explaining the cause of the delusional disorder. First, psychodynamic theory. Psychological factors responsible for the delusional disorder and biological factors responsible for the delusional disorder. Family. So some hereditary problems are determine the delusional disorder. Neurobiological. So nerve impulse, nerve transmissions are impairing causes the delusional disorder. So this theory or type of delusion, erotomanic delusion. In this, people believe the other people having affection in them. So that like they are believing. That is called erotomanic delusion. Actually, that person is not care about this person, but this person is not caring, but this person believes that is having affection on me. That like they are believing falsely. Second type, grandiose delusion. The person feel grand, so they may have unrecognized talent. That's like they believe I have unrecognized talent and I have great talents. I have great things. That like they believe in a grand way. That is called a grandiose delusion. So grand delusion. But actually they have know these things, but they believing falsely with a fixed manner. So even we go to them and say about they are not having this, but they are fixed. You are not matter. I have this. That like they say. Jealousy. In this patient believe their spouse or lover is unfaithful, is not true to them. That like they believe, but they are true to them, but they believe they are not true. That like one syndrome is have Othello syndrome. So in this same problem, so for this the person may attempt to suicide or vigorously act and may have more anger, persecuted type. These persons having believe they are persecuted and they are harmed by others. That's like they are thinking and they have a fear like this. They are harming me. That like they so, but they are not actually doing harm to them, but they believe like that, and that belief is fixed. So for if they see one person, that person is going to be harm me. That like they believe. In some situations, they may act violence, and get anger and attack the persons. So that person is innocent, but they believe they are going to harm them, and he attacked that innocent person by the form of the delusion. Then somatic delusions. They have delusions. They have fixed belief in. They have bodily problems. They have a bad order in their body. They have ugly. They have a misshapen body parts. They believe they are infested with insects. That like they are believing, but that are not true. They have no order. They have no misshapen. They have no any deformity in their body, but they believe like that, and they go to the hospital, neurologist and any persons, and go to check. These persons having sensational issues, so sensation of insect and biting like that sensation or false. So these sensation are not happening, but they have sensational issue, and they have some insect is biting me like that. They are tell nihilistic type. The person feel they are died, and their brain is vanished and their body is vanished, like that they feel. So they feel nothing. So I am died, so my brain is vanished, my body is vanished, like that they believe. They are fixed to it. So that is the illusion of feeling nothing, but it is fixed. or the persons may have a mixed delusions. One or more delusions come to the persons simultaneously. Unspecified delusions. So the person may have not any specific type of delusion. They have many multiple like this. For example, in quadrant syndrome, the person may feel they going to lose their possessions. That like they believe, and they try to protect. So they believe they are going to lose their possessions. Some persons feel they have lost already. That like they feel their organs, their status, their strength, their well-being are all lost. That like they feel in quadrant syndrome. A religious type. So in this, the person may feel they have some religious power. So in this specific religion, I have this power. That like they believe. How can we manage delusions percent? So first, psychotherapy. So first, rapport building is important. So trust is a key issue. So the person having wrong trust also. So we have to make a good rapport and make the patient to trust our. So the clinician should be very direct and honest. Then only the patient feels secure and they going to process of the treatment. Participation of family and client and others in this intervention, behavioral intervention, group therapy. So these are all going to help the person to get away from the delusion. I believe you have information about delusion disorder. What is delusion and what are the types of delusion? How the person believe there are, you have known by our video. So thanks for watching. Be proud to watch our video. I also need motivation. Please subscribe. Tata.